Welcome to the Holistic Matters podcast, sponsored by Standard Process. Standard Process is a trusted brand at the forefront of high-quality, whole food-based nutritional supplements. Visit holisticmatters.com for a wide range of holistic health content, including articles, videos, continuing education, and more, to keep you up to date on the latest nutrition science and herbal health trends. I'm today's host, Dr. Daina, naturopathic doctor and Standard Process clinical educator. Thank you for joining us, and I hope you enjoy today's episode. Hi, everyone, and thank you for joining me. I am so excited about today's conversation. We're diving into women's health and stress and how these two are deeply interconnected. And my guest today is superstar Dr. Annette Schippel, a chiropractor and graduate of Logan College of Chiropractic, who brings over 25 years of experience to her work. She owns two thriving family practices that focus on pediatrics, women's health, and clinical nutrition. And she regularly sees patients from across the United States and around the world. And she's known for her expertise in functional medicine and endocrinology. Dr. Schipple has become a respected educator, author, and speaker. And she's written and co-authored numerous clinician manuals and lectures domestically and internationally on topics in nutrition and functional endocrinology. She's had the privilege of visiting MediHerb in Australia for 3 years to receive advanced training in phytotherapy, and has also had the honor to speak on alternative approaches to metabolic syndrome in Beijing, China, at the 2014 International Health Management Forum. So Dr. Schipple, it's such a pleasure to have you on the show today.
Oh my gosh. Thank you so much, Dr. Daina.
That's
so exciting.
So exciting. Let's just start us off. Stress and women's health, and why does it seem like women experience stress differently?
I think a lot of it can be explained by just hormonal differences to start off with. And I think it is very well, I think it's very well known that we are more sensitive to the effects of stress, compared to men. And it really kind of boils down to our hormonal makeup, right? So for instance, there's sort of this balance of hormones. And the big one that comes into play certainly is cortisol. But we do have a distinct cycle, right? So we have this cycle that happens for 30 plus years. So when we think about that, I think it kind of ties into how the stress response becomes the biggest priority, right? Like the part of your brain, the hypothalamus, doesn't sit there and go, well, this isn't a big deal, or this is a small stressor. It just says, oh my gosh, there's stress. Whether that is lack of sleep, it could be something we think about, it could be blood sugar, gut issues, inflammation, or like a truly stressful event. In that, I think what we want to kind of understand is kind of what happens in this hormonal balance, right?
Yeah.
So if we think about it, the hypothalamus is sort of like the CEO, right? The CEO of the endocrine system, kind of assessing and trying to decide, who needs what hormone levels are like. But it does have a very intimate connection with that fight or flight response, and in particular with cortisol. So what we see that happens over time in this prolonged stress response is that cortisol, regulated by enzymes, which is regulated by the hypothalamus and the anterior pituitary, kind of becomes that dominating hormone. And if we want to think about why women in particular can be more sensitive to it, I want to talk about what goes on in that response.
Yes.
Because I think what happens in sort of traditional modern medicine, we sort of relegate the endocrine system down to just like this very linear thing, as if TSH and thyroid hormones, are one slot, right? And nothing else really impacts it. When the truth is, it's actually way more complex than that. And that kind of everything in the body is this little bit of a give and take. So when we think about a stress response, going back to the hypothalamus, it will send out either a releasing or inhibiting. That's kind of very, very fleeting. So as of yet, we don't really have a good way of testing it because it's too fast, which is a good thing, because could you imagine if every thought you had, everything that went on, your body was like a stop and start. So it's very fleeting. And then when it gets to the anterior pituitary, those hormones are more pulsatile. So they kind of have this more gentle rise and fall. But if we're thinking about it from a stress response perspective, we would start with the corticotropin releasing hormone. And when it lands to the anterior pituitary, it's going to actually cause an increase in TSH, ACTH. So TSH, think for thyroid stimulating hormone, ACTH, adrenal corticotropin hormone, and then prolactin. Now, some people might like, well, kind of like, what's the big deal? Well, it's a really big deal because I always think of like the thyroid and adrenals are pretty much like Thelma and Louise, right? They're each other's ride or die. Seriously, where one goes, the other one's going to go, or the one's going to try to keep the other one from, driving off the cliff.
Sure.
But here comes in prolactin, right? And this can have a huge impact on women in particular. And I think sometimes we think of, prolactin, this is for our nursing moms, but it actually plays a role in our cycle as well. So think about this. If there's a stressor coming in, we know TSH is going to go up, ACTH is going to go up, and then prolactin is going to go up. But the thing about it is that they are going to have an impact in the other major anterior pituitary hormones, such as FSH and LH, and also growth hormone. So why this is important is that when prolactin goes up, it has a suppressive effect on luteinizing hormone and also FSH. Now, if you think about that, if she is, like stress is happening maybe right before ovulation or prior to ovulation, this could keep her from ovulating. So this is where we can think of she might not actually have her cycle that month. Or because it's pulsatile, it could sort of have this rise and fall because whatever's happening that's causing that, but it will impact the second half of her cycle, which is called the corpus luteum. And what that causes, the degradation or the breakdown of the corpus luteum, lowering progesterone levels. And then how does that feel? It's not going to feel very good, right? This is going to lead into more PMS.
Yep.
When we think about sort of the nature of perimenopause, this can really start to affect her because it's also about how resilient we are in responding to stressors. So while I say this, it might sound like, wow, well, how do we ever have a cycle or how does these things happen? The problem lies when it becomes prolonged stress.
Yeah.
Because these pituitary hormones, right? This is part of nature. They're supposed to kind of rise. And then if the adrenals are really resilient, vibrant, and they respond the way they should, those pituitary hormones would not linger. There would just be like this little dip that we would never know about, right?
Yep.
But under prolonged stress, and again, all things that get favored, we start to lose that balance. We start to lose that resiliency. In fact, when we think about just stress in general, we have two hormones that are produced in the adrenal cortex, these major hormones that are part of a stress response. It's cortisol and it's DHEA. What's cool about it is that when they rise together in an appropriate stress response, they kind of balance each other out. We feel the benefit, right? Like the upside of stress. We feel the benefit of it. But when it stays prolonged, the hypothalamus is always going to choose cortisol. And that's because you would die without it.
Yeah.
We all want to hate on cortisol, like, oh my gosh, I got a cortisol belly. I got this, I got that. Hypothalamus doesn't care. Cortisol wins the day, right? Because you would die without it. And it doesn't care if all these other androgen hormones are much, much lower.
Yep.
So when we get into prolonged stress, we lose that resiliency. So then it's like the adrenals have been running a marathon for the last 10 years, right?
Yep.
So then when it comes about, it's like, seriously, I have to respond again. And with that little bit of delay, then it's like TSH and prolactin, like, okay, all right.
Yep.
All right. Well, I guess we're going to hang out. And the other thing that comes into that is that I want to bring up that prolactin has an inverse relationship with dopamine.
Yeah.
So kind of like a very real feeling of this neuroendocrine system being intertwined. And I was thinking about our call today, and I was thinking about how, women are more likely to get an autoimmune disease over men.
That's a big one.
And it is a big one, right? And we could think about, the imbalance of a prolonged stress response. And there's actually been some studies and some implications tying it back to prolactin as well. And I think
interesting.
It's really fascinating. And it's not, I want to be really clear. Prolactin, because it's pulsatile, you may or may not catch on a test because it's not going to be like screaming high as if someone has like an anterior pituitary tumor. but it has this little rise and fall. I recently was looking at a blood test. This is kind of fascinating. I was working with a new patient, and we're looking at, you know, tests that were just about 2 weeks apart. And she's a practitioner, so she was like, "Whoa, don't like the look of this one."
Yeah.
And, you know, so she did a second test. And what was really interesting is that not that the prolactin was too high, but just in a difference of like a week or two, it dropped in half from where it was.
Wow.
And then there was this whole component where in the next test, her white blood cell count was lower than ideal, which is a sign of chronic stress. Then we saw this huge viral load as well. So there was a lot of very interesting things going on. And I think those are some of the nuances that we miss. And instead, as women, we're like, oh, you're just hormonal, right? And like we're not.
You don't want to tell a woman that.
No, right? Do not say, oh, you must be on your period, or oh, you know, are you having a hot flash? That, no, it's no wonder we get so angry, right?
Now, what is it? I have to ask, because I want to know a little bit more about you. So you mentioned a lot of hormones that I think a lot of people, they might not even think about. I mean, prolactin and dopamine, you're getting into some of this deep endocrinology. What if we pulled back? What about like DHEA and androstenedione and testosterone? I mean, is there something to these hormones and the way women experience stress, you know, different than men?
So I think so I'm glad you brought me back to center, right? So when you think about the hormone family. So first off, you know, probably, no, without a doubt, if we were looking at the steroid hormone family kind of on opposing sides, the two strongest hormones are estradiol and cortisol.
Okay.
So estradiol is actually stronger than testosterone.
Wow.
So kind of keep that in mind. Now, the difference, I would say, like if we're looking at male and female physiology, right? Men carry way more testosterone, whereas we carry more estradiol. But here's the thing when I think about the impact of stress, right? For us in particular. So first off, you got to think about estradiol. It's a very, very necessary, it's a strong hormone. It tells things to grow.
Yep.
It promotes autoimmunity. It's kind of inflammatory. It's neuroexcitatory, right? Like it's got all these like moments of it. Now, think about what is the balance to it. So the balance, if you can kind of imagine, I know they can't really see my hands, but if we had estradiol down here really strong,
Yep.
on the other part of the steroid hormone family is progesterone.
Sure.
So progesterone is very weak, but it's very, very abundant, especially in the cycling female. So it creates this balance. So whereas this one is like all of like angst, progesterone says, hey, it's okay. We're all going to be calm. It's all going to be good. So they balance each other out.
Sure.
Now, if we look at cortisol and DHEA, so this again is looking at the primary, not the only hormones that the adrenals make, but these are the primary ones when it comes to stress response. The reality is the adrenals can make the entire steroid hormone family.
Yes.
In small amounts and also via precursor material. But now think about this side of it. Cortisol, one of the strongest on that side of the family. DHEA is very, very, very weak, but very abundant. So its job is to balance the cortisol out. So the cortisol and DHEA balance each other out. But DHEA also acts as a precursor to androstenedione, to testosterone, and ultimately can also convert down to dihydrotestosterone or down to the estrogen. So it's an upstream hormone that is abundant but weak. So notice that progesterone and DHEA are very, very upstream. Cortisol and estradiol are the downstream. So when we talk about women being more sensitive to stress, it is really because of the impact that stress has on that balancing hormone. One is progesterone, but the other is under chronic and prolonged stress, she will have lower levels of DHEA and cortisol gets sort of, preserved, if you will. And then honestly, we were not meant to have the same level of DHEA testosterone as men. So men carry more DHEA. They have a lot more testosterone.
Yes.
So that effective stress hits them just a little bit differently. And then when we think about, kind of if you don't care if I go into perimenopause and menopause,
Yeah.
when we go into menopause, it's okay, right? Like here's this beautiful change. We don't need those high levels of progesterone and estradiol anymore because we're not, trying to sort of reproduce ourselves in the same way. Hormones, that is part of it's almost like you could say puberty in reverse, or I saw someone there to say called it puberty 2.0. But because we don't ovulate, we're not going to make this big flood of progesterone, but also because we're not ovulating, we don't have as high levels of estradiol as well. So they both naturally come down together and then ideally stay in this still very balanced state. The
Sure.
problem is, though, how well the adrenals are, how happy they are going into menopause is really going to predict how easy that transition is.
Yeah.
But does that make a little more sense?
Yes, that makes a lot more sense. And then, kind of speaking on that in that same vein, you're talking about this perimenopause. I mean, we have more women entering this phase of life. And I know this is a primary part of your practice. What are you seeing in clinical practice as it relates to this stress response, these burned out adrenals? I mean, they they can't compensate anymore, right? Their body has been compensating. Now they have less hormones. And now what's happening?
Well, I think the interesting thing that happens in perimenopause is that, it really does come back to the resiliency of the stress response. And if you think about it, they'll tell you now perimenopause is 8 to 10 years before menopause. I'm sorry. That is an awful thought. Like that is awful. I've had women come to me 40 convinced that they're in menopause,
Wow.
but they're really not. And ideally, if we thought about where perimenopause should live, it should be 2 to 3 years before menopause.
Wow.
And you should experience, you'll experience some fluctuations. And I think if we can kind of embrace the little fluctuations are okay,
Sure,
right?
sure.
Because it's a natural transition, just like puberty is a natural transition. But the problem is, I feel like a lot of our women are coming into it already stressed out.
Yes.
They're already, dealing with, whether it's a family, it's a career. Sometimes when we get into our 40s, we maybe have lost some significant people in our lives, possibly a parent, a grandparent. It, sometimes job losses or moves. It's adulting, all over again on steroids, right? It can be a really, really tough time.
Yep.
And I think because of that, we're starting to see more women be symptomatic. And
Okay.
I'll tell you what's really interesting is that what I find almost again and again is I find various signs of chronic stress. Many times the thyroid is still fine, even though they're convinced that it's not. But when I go in and I look at the adrenals, and that's sort of where the trouble is at, because the adrenals, when they're out of balance, negatively, it's going to impact our gut, our immune system, our sleep, our blood sugar, our mood, the whole bit. And a lot of times we're just trying to find ways to look for that dopamine, right, that gets suppressed under stress.
Yep.
So we're looking for the carbs, we're looking for the glass of wine at night, which kind of just sort of exacerbates all of it. And so, first off, and when I approach it, it's like, first, you got to have the conversation. So many women do not even understand what their body's trying to tell them, how their body's working. They are immediately glomming onto some pretty tragic band-aids, right? They
Sure.
got heavy bleeding. They might be put on continuous birth control. There might be an ablation. Someone else might step in and say, oh, well, here's just some bioidenticals, instead of actually correcting the underlying issue.
Sure. Yeah.
So for me, and it's kind of an interesting thing because I feel like I discovered it kind of early on, maybe before I fully understood all the interactions within, our endocrine system and the steroid hormone family, was that if I gave some really good support to the adrenals, I found that the overall female hormone support, even for that perimenopausal female, I didn't need to do quite as much.
Hmm.
Like as long as that adrenal support was there. And I sometimes feel like that's where clinicians kind of miss the boat. They're like, oh, let me do this and this and this for your hormones. I'm like, well, what about these adrenals?
Yeah.
Are you making sure that that is well taken care of? Are you talking to her about the lifestyle changes that she needs to make to allow them to recover and be more resilient? So I think you're right because it is like a hot topic on social media.
Yep.
Everybody's talking about perimenopause, which we know, that's, it leads into actually more confusion, if you want to be honest. And then we got the menopausal female, feeling like she's not really sure what's going on with her body. And some of them are still feeling the same symptoms when they entered menopause 10 years ago now. And
Yeah.
that's just okay.
And, I think that's really interesting because it's almost like something that doesn't get talked about a lot, or maybe it's something your mother hasn't told you about, or it just gets glazed over in those conversations. Oh, your mom might tell you, oh, I went through menopause at, name an age, 50, 51, right? But they don't tell you, what it's like. And the fact that this perimenopausal phase is taking so much longer to get through. Like you said, this should be a couple of years, not 10 years where you're having intense hot flashes. I mean, tell me a little bit about what should a woman who's going into menopause or, going in this perimenopausal journey, what should they be experiencing? I know you said these fluctuations, but what are some things they can do? What are you talking to your patients about? How do we make their adrenals resilient?
So I think that like when we're thinking about, the perimenopause versus menopause, right? There's two distinct categories. And I will say that I've had women like come to me about 46, 48, and they haven't had a period for a couple of years. I'm like, I warn them, I'm like, listen, when we start supporting your endocrine system and your adrenals appropriately, your cycle might come back.
Oh,
Because
yeah.
again, yeah, you can have this what's kind of like, hypothalamic amenorrhea, right? Like stress induced,
Yep.
loss of a cycle.
And it's not a bad thing, right? I mean, that's important to maybe let her know, or that had she been supporting the adrenals before, it would have just been continuous instead of having this lapse.
Right. And it's kind of funny because when women I mean, it's, when we're in our early 40s, we're sort of can't imagine menopause because, again, it's the big unknown. Most of us don't have, I mean, it wasn't talked about. Like you said, my mom didn't talk about it. I just remember looking back, my mom crying a lot. My mom and dad seemed to argue a lot and kind of wondering like what is happening. Of course, I was, I'm the youngest of nine, so I was quite young. So I feel like one thing that whether the conversation is always correct in social media, meaning our choices about what to do, I do appreciate the conversation
Sure.
because I think that that is really, really important. I think when we get into the perimenopause, I think first is just you got to really understand where the adrenals are at. And again, this is kind of it can be a little bit all over the place. So, for instance, I'll find some women actually deal more with lower blood sugar, not necessarily higher. So, in that situation, if your blood sugar feels like it gets a little too low based on hypothalamus, cortisol is going to surge, rapidly bring up glucose. DHEA says no and antagonize insulin. So, even something as simple as helping her find the right diet can
Mm.
make a huge difference in her mood as well as her energy. So sometimes it's not the ketogenic diet, right? That everybody thinks they need to do. Not everybody needs to do restrictive time eating. So first figuring out where she's at, we got to talk to them about sleep. Are they sleeping? The studies will say we need at least 7 hours, but women, studies are showing more recently, we need probably 8 or more.
Yeah.
So total. So there might be a little bit of an interruption, right? But we want to talk to them about their sleep, about their diet. And another big one is the exercise, because there can be this weight gain, right?
Yes.
And sometimes that weight gain is very protective. Like, again, your brain kind of doesn't care how you look. Its job is just to keep you alive in this survival mode. So sometimes they will do, you got to talk like, are you doing really aggressive, high cardio, cortisol stimulating exercise
Yep.
in a system that has already gotten a little bit out of balance? So I always try to start with like the lifestyle, it's kind of like how you sleeping, how you're pooping, if they're perimenopause, what's their cycle like? Are they missing? And then looking at mood and energy. Then, because I think that's sort of the foundation. That's sort of like their piece of it. But really bringing in some key herbs, oh my gosh, can make such a world of difference, that are both supporting, certainly the adrenals, but also dealing with what they have going on.
Yep.
And I don't know if that's where you're trying to lead me, but this is honestly, I have some really, really favorite herbs when they're in like this perimenopausal state where emotions can be running all over the place, where they might experience more sporadic or even heavier bleeding, and then getting a little bit anemic. And it kind of like, one is, builds on top of the next. And, I think what's kind of fascinating to me, I'll just list two of my favorite herbs, right?
Okay, let's
Especially
do it.
perimenopause. So Romania. Romania, we think of is for first and foremost, it's a tonic for the adrenals. It's tropho restorative for the adrenals. So it's this beautiful herb for the adrenals, but it's also anti-hemorrhagic. So when one of the consequences, I think, of not having resilient adrenals when the throes of perimenopause is that heavier bleeding. So we really have to address that. But it's cool that if we bring in something like Romania, we're really kind of multitasking.
Yes.
It's also good for joint health. It's good for autoimmune. So it's got all these beautiful benefits. Then I think of ashwagandha. It's this blood building herb. It's that herb in Ayurvedic medicine we talk about for failure to thrive. It normalizes cortisol, helps bring up low DHEA. It's also supportive to the thyroid, just overall function. It's considered a neuroendocrine immune, meaning it helps with anxiety, insomnia, helps with our immune system. So those two paired together can be incredibly important for that perimenopausal female, because now we're supporting her all the way around.
Yes.
We can certainly use things like chase tree, which is going to help normalize prolactin. It's a dopamine agonist, supportive of LH and the corpus luteum,
Yep.
because we really want her period to be as normal and as good as it possibly can be. So then she just has that last period one day, right?
Yep.
The last period that is going to mark the beginning of menopause once she goes without a period for a year. So I think that is, that is certainly one that I think I use all along, but maybe use a little bit more, in that perimenopausal state, but it's not enough on its own, right? So making sure that we've got that appropriate endocrine support really, I think, is going to be key. And, if she's dealing with like the heat surges and, little bit of hot flash, if you will,
Sure.
Romania is still very good for that. But here comes Shazandra. So Romania and Shazandra can be really good for those heat surges and those hot flashes and so forth. It just so happens that Shazandra is also considered an adaptogen for the adrenals. It helps with mood. It helps with clarity of thinking. It helps with energy. And a really beautiful bonus of Shazandra is that it's phase 1, phase 2 liver detox support, which is really about how our liver is going to eliminate endocrine disruptors,
Yep.
hormone conversion, all the things that we want our liver to do. And, and just really just maybe 4 simple herbs with a good foundational nutritional support can make a world of difference.
Yeah, absolutely. I mean, you've been talking about it this whole time, but herbs are so beautiful in that they're modulating. I mean, it doesn't have just one action. They do not work like pharmaceuticals where they'll just, inhibit one specific enzyme in a pathway. They modulate across different organs, across different tissues. Just beautiful. And then they work together. They work, synergistically. So I love herbs as well. Now, you mentioned one that's one of my favorites as well. I love ashwagandha, but I also see on social media, I see some interesting trends with that one and other ones too, but I'm wondering if you can talk about just some of these social media trends. I mean, what's real and what's not, and how do we
Oh,
know?
oh my gosh. Honestly, I think that you want to get me fired up. Like, first of all, go after my herbs, and second of all, go after ashwagandha. It's kind of, if you, and I know you've dealt with herbs, that's your background, you feel the
Yes.
same way I do. I think it's always fascinating that the more popular something becomes,
Yep.
then people start going after it. And sometimes I kind of question who is pushing that, right? Because I'm like, okay, we're talking an herb that you could give to an infant that is not thriving.
Failure to
I'm
thrive,
talking an
right? I mean, that is historical use with ashwagandha, failure to
yes.
thrive.
So then I had a colleague send me a screenshot of someone on social media saying all the things that ashwagandha would so-called quote in quotation marks be
Sure.
bad for. Like, those are all the reasons you would use it. Normalize cortisol, normalize the stress response, support thyroid function, support the immune system. It's a natural blood builder. I mean, that's to me is like a really big one in perimenopause because of what we see with like the heavy bleeding and different things like that. So I had to kind of chuckle about it. And I had to like go, of course, we don't want people to be well. So let's demonize this. Now, I also want to point out, though, that the more popular an herb becomes, the more likely it is to be adulterated.
Yes, good
And
point.
that means it might not be therapeutic at all. It could be cut with a chemical, a synthetic, or other herbs that maybe do not go well for us. But when you get a high quality and it's got the right phytoconstituents, if you will, or the phytonutrients, it's rich in lithanolytes, the things like that, then there's tremendous benefit. And so again and again and again, I have to have this conversation right now that social media is both a blessing and a curse in that. So another big one I love is like, ashwagandha is a nightshade. I'm like, oh my gosh, here we go again. Just because it has alkaloids, which is common in nightshades,
Sure.
actually does not mean it's a nightshade, because the plants or the things that we eat that are actual have that nightshade problem, the joint pain and things like that, they contain solanine. They contain
Mhm.
that alkaloid solanine. Well, guess what? Ashwagandha doesn't contain that. So I think it's kind of like patient beware of what you see, on the internet or on media, because you can call something one thing and not give the full story. Well, wait, we have that happening all the time.
Yep.
It also takes it back to why it is so important to work with a qualified healthcare practitioner and not try to self-treat, not follow the latest trends, just buying whatever looks fancy, off the internet. Because I always tell my patients, you don't have access to what I have access to.
Yes.
And even if something looks good, I think we talked about this the other day, just because it's good for you doesn't mean it's right for you.
Yep.
Like, what is going to be the best choice? I could also argue for someone who looks more depleted, I might choose eleuthero over ashwagandha. They're not anemic, but they're depleted, maybe have like a kind of a viral maybe history background. I might use eleuthero, astragalus, schizandra, and maybe licorice instead of Romania. I mean, I have these choices that I can pull from based on the person sitting across from me, because I do not have cookie cutter. I don't have a one size fits all.
Yes.
But I mean, I've always said, like, if you don't know where to start, ashwagandha is not a bad place to start, right?
Yes.
And I want to say on that, I've also used it in the elderly, like someone I would say is in that failure to thrive. And
2.0.
so, yeah, yes, absolutely. And see it make like an unbelievable difference in a short amount of time.
We'd like to take a quick moment to mention our sponsor, Standard Process. Standard Process, a family-owned company, makes high-quality, whole food-based nutritional supplements. Standard Process was a pioneer in whole food nutrition. Many of the ingredients used in the company's whole food-based supplements are grown on-site on their 850-acre certified organic farm. They're passionate about cultivating nutrient-dense soil, which maximizes the nutrient density of the plants that end up in their products. Standard Process is inspiring a new era of whole food nutrition innovation that remains dedicated to your practice, your patients, and your health. To learn more about Standard Process, visit standardprocess.com/only@SP.
Yeah. And I've always wondered, because as a practitioner, sometimes I have like a patient presents and there's almost like a picture. And right, you look at their labs and you see what they've been experiencing, their immune challenges, their diet, their history, their stressors, and it creates this picture, and that helps you to bring forward the herb that will be right for them and the nutrients, right? I mean, can you give us some of those, pictures, or even a case study if you have a patient? I'm sure you have a lot of patients, but if you have a case that you'd like to share with us, just where these herbs, resonated beautifully with your patient.
So, I think what's interesting. So I was thinking about one that I just had. So if someone, and this happens, and I've seen this where someone is seemingly stuck in fight or flight, and and if they get stuck there and they're kind of still pretty strong, cortisol can actually look elevated. It can still be in the circadian rhythm, but it's like they're stuck there. On the downside, though, it can suppress TSH. So you can see it's not that they have elevated thyroid hormones. It's more about what's going on in this acute fight or flight response. So this is a great example of where I would use ashwagandha, right? Because it's going to normalize the cortisol. So when cortisol is too high or in this sort of, I think, like a roller coaster, ashwagandha is sort of that soothing kind of like, hey, we need to like calm down, because it is both a tonic and an adaptogen. And it's not, higher on the adaptogen side, like say like a Luthro. It's a little more balanced, probably like a 60-40. So in a scenario like that, this could be really good. And I remember in that, when someone's got that sort of that stuck pituitary, and I'm going to explain how I would approach this.
Yeah.
Is I remember listening to Lee Carroll. He's, a great herbalist that I've had, the pleasure to learn from. But he would talk about in herbal medicine how you use Rehmannia for stuck pituitary, which also makes sense when someone's in this sort of high stress. Because the other thing about Rehmannia and ashwagandha, I always find them very calming, very soothing. So they don't bring heat. Like they're not going to add more heat to someone who's sort of like hot
already
and bothered.
Hot. Yes.
Yeah. And even sometimes using hawthorn for that person stuck in sympathetic dominance, which kind of makes sense, because how does their heart starts racing, they start on this like high, like adrenaline. It makes sense that hawthorn would be this beautiful component that I could add to it. Right.
Yeah.
Now, so that's kind of where I go and it's interesting because again, it's looking at a bigger picture, right? Looking at this full picture, because one of the things we might see is in a heightened stress response, sometimes the white blood cell count might be slightly elevated, right? Rehmannia would still be a good choice.
Yep.
Now, let me explain someone who's more depleted.
Yep.
So this is that low energy. It's that, oftentimes we'll see that lower white blood cell count. And it's just sort of that a little bit of a change in that vitality.
That exhaustion phase, right?
Exhaustion phase. And this is also where they tend to be colder, right? Not so much that they've got that broken thermostat. They might be more cold, just overall less resilient. In that, I really love Eleuthero. Eleuthero is a much stronger adaptogen. We also know it is a beautiful support to the immune system, especially where there's like this kind of like this viral load or post-viral. Because again, I think of, as women, our ability obviously to develop autoimmune over men. But I really love Eleuthero. And oftentimes that more depleted person, they got that lower blood pressure. They're just drained. I love licorice. Licorice would definitely be one of my favorite herbs in that situation. Astragalus, astragalus for the depleted individual or convalescence, the low white blood cell count. And then Probably the other one I love to add to that, honestly, is Shazandra, just for that overall support of endurance and energy and also mood. Because how do you feel when so the flip side, when you're really exhausted, that lower mood, not as clarity of thinking. And that's where Eleuthero and Shazandra help and astragalus. So it can look a little bit different, right?
Yeah.
And I don't know if that kind of helps you with what I would do, but I've seen that picture. I've seen that picture of, the depleted person. Okay, so I have a funny story.
All right.
So I kind of made this tonic, and I would say I've learned a lot, but I love to blend tonics. And this is probably one of my first patients ever, right? And early on, I would look at adrenals and I look at like postmenopause because it was like, okay, she's not quite the moving target as our cycling female or with the menstrual cycle. So this patient of mine, her total, so to kind of put it in perspective, your total cortisol load with the test that I use should be probably ideal would probably be around 30, right?
Okay.
Total cortisol, in a 4 sample as far as that goes. Her total for the day was a 9. A 9.
Wow.
Now, I know like how she would
Getting
get up
out of bed.
I know, sheer determination. I was convinced of it. So I'm like, okay, I'm going to use these herbs. I'm going to use Eleuthero. I'm going to use licorice. I don't remember if I used astragalus, but I definitely had like licorice in there. So here's the funny part, because licorice gets the bad rap because at high doses, it can displace potassium. Now I'm pretty clear about what I'm doing. And I'm like, all right, you're going to do this concoction, a teaspoon twice a day. So I'm trying to make sure that she doesn't get too much licorice, and an overall load. And then of course, support her appropriately, right? With all the other nutrients. She comes back to me in 2 weeks and she's a little puffy. Her hand's a little puffy, ankle's a little puffy. I'm like,
Little swollen.
Possibly a little bit of an issue with potassium, but I'm like, oh my God. Okay, what did I do? So I'm going through her whole protocol and I get to the tonic and I said, okay, so a teaspoon, you're taking a teaspoon twice a day,
Yep.
which is 5 mils for everybody out there. She bug-eyed looks at me and I'm like, oh no.
Uh-oh.
She goes, I thought that was a tablespoon. I'm like,
no.
oh my God. So she was doing equivalent of 6 teaspoons a day. But here's the thing now at first I went like, okay, well, nobody got hurt. Like everybody's okay, and here was the neat thing about it. It didn't damage anything. It wasn't permanent.
Sure.
Well, clearly we're going to back down to a teaspoon twice a day. And basically I just gave her, some whole food support that was really rich in potassium, just giving her a lot more bioavailable potassium.
Yep.
It completely normalized and never had an issue. And I think that's such a great example of understand what's going on, because the chances are with someone like her, I still did not back down on what she needed. She still needed, I really felt strongly about licorice, because licorice also can really help prevent the degradation of cortisol. So as a tonic and tropho-restorative, very much like Romania, but it really kind of lifts things up. But it also goes to say that someone who's depleted, might need more of these other nutrients. Of course they do. They need the minerals, they need the potassium, they need the B vitamins, the vitamin C, all the things that also help strengthen and heal those adrenal glands. And it was just, oh man, that one has stuck with me. And I just want to point out, this was over probably 25 years ago. She's still my patient. She's still my patient. And then like her whole family has become my patients, but it's the beauty of what we can do, and also to create that lifelong, patient. But yeah, it's kind of, that presentation, I kind of look at so many things together. When I first started, I didn't look at blood chem. I was really focused on saliva tests, and I would do hair analysis and things like that.
Sure.
But you have to kind of, step up, because the fact of the matter is that's a common thread in all types of medicine, if you will, functional, the traditional. So by understanding it, I have gained a lot of new insight
Yeah.
into how I would support that patient, because it tells you, are they anemic? What different ways we might see signs of stress. So for instance, hyper adrenal activity or hyperthyroid, you could actually have low cholesterol and low triglycerides. On the flip side, elevated cholesterol and elevated triglycerides could indicate hypoactivity by thyroid and or adrenal. So there's a lot that's just one example, but there's a lot that we can gain from that.
Yes.
As you're talking about, how do we complete that picture? And also being able to talk to patients in a way that empowers them. That's what I love. I want to empower them to take charge of their health.
Yes. And just back to that case, I mean, I think it's fascinating. I mean, nobody can tell you that herbs don't work, right? That is just a classic example of there is such power in herbs. And of course, you want to make sure you're utilizing it, very specifically and precisely. But I can't tell you how many patients will, get on that herb that sometimes on an energetic level, just resonates really well with them, and they just feel so much better. They come back to your practice 4 weeks later and they're like, oh my gosh, what is this? This is amazing. And that's very unique to them. And that shifts throughout their lifetime too, right? I mean, it's not the same herb that they've been on since puberty all the way into menopause.
Well, and I think that you're so brilliant. You brought it back to this. I love this. But it also, I think about what resonated for me. Like when I was younger, like meaning in my 40s, and then what I resonate with now in,
Yes.
postmenopause. So, I love ashwagandha a lot more than I did. That didn't, like, I think because I went through some pretty not extreme, well, it felt like it, but like adrenal challenges, going through school, having a baby in school, my third child in school,
Wow.
having another one shortly after, all the different things, moving, trying to start a practice, trying to figure out my place in practice. So what felt really good and what I needed then has shifted. Younger, I would say I was all about the Eleuthero a lot more. I've always loved Shazandra. You're never going to take that one away from me. But, I use a lot of rhodiola and Korean ginseng, and I use just different things. But I found in going into menopause, Rehmannia was more important. Ashwagandha became more important. Even Shazandra, hit up, a bit higher. I didn't really need Chase Tree. That really, although I'm not saying there's a need for it in postmenopausal women where we're using it for dopamine or melatonin. I think it's not just an herb for a menstruating female. It has,
Sure.
Benefit, or anxiety, it has benefit in both places. But I even notice, like you said, like what changes for our patients is also what changes for us as well.
Yes.
And it's kind of a beautiful thing to see how that shifts
Over time, absolutely. And another question, because this comes up a lot in practice as well. What do we talk to our patients about in terms of libido and vaginal dryness? There's a lot there. I mean, hormones are changing, things are changing. And what are some, nutrients and herbs? I mean, what are you using in your patients to really help bring that back to life?
I think that's such a critical conversation, because unfortunately what happens is that and I'm going to say the majority of the story is, oh, libido's gone, this and this. Well, here's the bioidentical.
Sure.
And then I'm like going, okay, wait a minute. That would imply that somehow this transition into menopause wasn't normal, that we were never meant to go there, or some kind of crazy stuff like that, which is not true. So I kind of come back to looking at, well, what is at the heart of it? Well, first off, if she's exhausted, do you think she's going to have, strong desire? And I think that's where I think sometimes women are unwilling to admit how tired they are. I mean, let's face it, having sex for women I think is very emotional as well as physical. And
Yep.
if you're not feeling all of that, for that person, it can be quite difficult. And, I always talk about, foreplay starts in the morning. It starts with a kiss. It starts with, someone getting someone else a cup of coffee, i.e. that's me. I love my coffee. But it's the little things that I think make a big difference. But part of it from a physical standpoint, I think it's just the sheer exhaustion because it's like, the drop in hormones doesn't necessarily mean a drop in desire, right?
Sure.
Now, I think the other component that does tie into that, not just the tiredness, is the microcirculation.
Yes. Blood flow.
Blood flow. Thank you very much. I'm like, okay, women, your vaginal dryness and loss of libido is no different than his erectile dysfunction. It is a circulation problem at the heart of it. If you do not have good blood flow to the vaginal tissue, to that area, it's not going to plump up. You're not going to have all the things that you're going to be more dry. You're going to have less desire. I mean, we got to think about the circulation. And I feel like that gets missed. Yeah. Can you put someone on hormones and immediately probably make them feel better? Well, of course, you're putting them on steroid hormones. Are you kidding me? But that is not without risk. So I go, okay, what is it that we need to look at? Well, we got to look at things that are estrogen modulators. We got to look at things that are good for the circulation.
Yes.
And we also need to think of, I think, like a whole body tonic and energy in that sense. So go to cola, microcirculation, one of my favorites. It's also really good, like just for tissue, connective tissue, anywhere in the body. I think it was Angela Highwood. She's the first one I heard call it Botox in a bottle, which honestly, all you have to do is say Botox in a bottle and you women are going to take it, right?
Yep.
But it is really good for the circulation. Ginkgo is another one for microcirculation. Korean ginseng as like a whole body tonic, a whole vitality, but is also going to help with that. And honestly, I mean, you've got some choices. I use a lot of black cohosh because I can blend with that. But it is specific, though, for vaginal dryness, vaginal atrophy. It's also can ease menopausal symptoms. It's good for arthritis, which tends to be something that we get worried about, when we're, in menopause. But certainly wild yam, we've got shatavari. These are some other great ones when we think about more on that libido side of things. But you got to think about the microcirculation. I think that one thing that we're going to I'm seeing more like, different talks about increasing nitric oxide, right? If you can increase nitric oxide in circulation, that should help with vasodilation, which is going to help with blood flow. That might be using, our red algae, using, highly concentrated, beets and beetroots and mountain spinach. These are all like really high red foods that are known to increase nitric oxide. So I think that is going to be another benefit. But even just looking at, all the ways that we need to have healthy hormone conversion and hormone elimination. But in that, I think the libido, because it's been fascinating to me. I've heard, it's a hit or miss, like tribulus is a good herb that can ease menopausal symptoms. And as, talked about for libido, I don't always find it. I don't always find that tribulus is a key or even shatavari. Sometimes I'm back to the ashwagandha because it is that stress. Because you got to remember, if you don't normalize cortisol and she's in a prolonged stress response, what does cortisol do? It causes that vasoconstriction. So you do not have great blood flow to all the areas of the body. And I think that is why we want to take a more personalized approach to it. Because for the one person where it might be tribulus. I've even, some women talk about, practitioners said using Tongkat Ali. Maybe I just attract all the really stressed out women. I don't, I kind of think I do, but that's probably another big herb that I use because I am focused on the normalizing of the cortisol. And just to be clear, and I know you know this and I know this is when you said herbs are modulating.
Yep.
We have to remember they don't take things too far. When an herb is a modulator, like black cohosh, it's not suddenly going to make estrogen levels too high. It doesn't work like that. when I talk about ashwagandha or lutro supporting, natural cortisol levels, they're not going to make them too low, nor are they going to make anything too high. It's just not the nature of an herb, which is why, I love them so much and you love them so much.
Yeah, and I think wild yam is another kind of example of this
Yeah.
one, right? Because you hear this and, people putting wild yam creams or I'm not quite sure how this works, but what would be your comments on that?
Oh, I love that you brought that up. So it's funny because wild yam as an herb is an estrogen modulator, right? And it can also help. So it can help with regulating a cycle in our menstruating females. It's not just, for perimenopause and menopause and beyond, but it is really in that category, like black cohosh as an estrogen modulator. Here's where the confusion comes in though, right? Because you can take that plant and compound it in a pharmacy. So you took a plant and now you've turned it into something else. That the fact that it can be turned into either an estrogen cream or a progesterone cream, but that's not what the heart of wild yam. That's not how it behaves as a plant. And I think that's where like the confusion gets people like, oh, well, I can't do this because somebody turned it into a bioidentical, and then they make the plant itself seem like a bioidentical, and that's just not true.
Yeah.
Yeah,
Thanks for clarifying, because that's always, I think there's so much confusion. And like you mentioned previously, the more we see social media and the more our patients are on social media, it just seems like sometimes there's more confusion. It's not actually helping the cause.
I know. I never thought I would hate the words. I've been doing my research.
Yes.
Oh my gosh, because there is a pitfall into what's on the internet and social media. I have people that they don't even try. They go to Chat GPT and ask questions, and you got to understand that takes everything that's put out there, and you got to remember everything that's put out there. What's probably the majority of it put out there, and by who? Probably by
Yes.
pharmaceutical companies. It is not the same as working with someone who has spent thousands of hours studying a subject or understanding herbal therapy, nutrition, and things like that. And sadly, it's not going to be your OB-GYN. It's
Yeah.
not. Most of the time, it's not. At best, we hope that they're open-minded to it, but that is not what drove their education. And that's okay. That's not, but I feel like a lot of times I tell my patients this, especially the new ones. I'm like, you're asking the right questions, but you've been asking the wrong doctor.
The wrong practitioner, right?
Yeah, you're asking the wrong practitioner. And, on one hand, I love that they want to understand more. I love that they want to understand their body more. But the problem is that they don't know how to necessarily filter the information. Because there are some really, really great educators, I think, out there. There's some great podcasts. There's some people that are really doing a great job of promoting overall wellness and a better understanding about the body. But there's a lot of people that got their herbalism degree online or whatever you want to call it. And the fact is, still, yeah, you can pretty much say whatever you want. And it doesn't necessarily have to be true. So I try to, acknowledge that, that they want to know more. And I think that's great. And I'm really appreciative of that. But it's kind of like, how can we kind of come together to have a better understanding? And, I always say that, this kind of comes into like lab testing, right? Being healthy is a journey, right? It is a journey. It's not, nobody does it for a month and says, oh yeah, I'm good. We try to do that with the diet, right? Like, yeah, I did this diet, I lost the weight. And then, but if you went back to eating the way you did before, guess what? You would gain that weight. So always try to talk to them about like, this is a journey. And when I looking at your full health history and I'm looking at labs, this is like putting a destination into Google Maps or Apple Maps and say, okay, we want to get from point A to point B, which let's just say is across the country.
Yep.
Now, you could meander and wander around. Like sometimes I'll use the Statue of Liberty as an example, go find a coast, head east and, until you see the lady out in the water, right?
Yep.
That might take a really long time, might not find the most direct route. You might, in fact, wander in circles and all this other stuff. So I said, when you work with a practitioner and we're looking at labs and we're looking at things like that, we're trying to find the most direct route. I go, but like any journey, it's not without its challenges.
Yeah.
There's going to be detours. There's going to be potholes. There might be a flat tire. There's going to be a storm. There's going to be the things that are going to happen along the way, but you're still moving in that journey. And that's kind of like how I feel like, you work with someone, you become a team, and it's like, okay, this is how we're going to course correct. Oh, we got a little off track. All right. This is how we're going to come back in and really just kind of keeping it in mind that it's not over. It's just not over. Everybody can be better, feel better, live better. It's a matter of choice. And I think that's a beautiful thing, that no matter where you are, there are things that you can do to improve your overall life, your vitality, your health, and just bring more joy to your life.
Yeah, I love that. It's such a beautiful analogy, that you just mentioned. There may be a detour. This herb may not work for you. These labs may go up or down. Maybe it's not even in the right direction, but it is a journey. I'll help you through this. I will help guide you through this. And look, there's a lot of beauty on the way as well, right? You get to see some scenery that you may have not seen otherwise. And so it's such a journey. I love that. And, if you were to just, if we have healthcare practitioners listening to this podcast, we have patients listening to this podcast. I mean, if you were to just, kind of sum up what your take home is today, what are some key points that you'd like, the patients and the practitioners alike to know before we end this podcast today?
Oh, man. I know. I should know better. I've listened to you so many times. I know that question was coming.
Everybody gets an opportunity to give us some key takeaways. I mean, you were absolutely going there, and especially as it relates to back to women in stress. I mean, we talked about the hormones, we talked about the herbs, we talked about, the immune system. I mean, we've touched on so many different pieces today, but especially as this relates to our patients, women, the stress response. I mean, what advice would you give to them?
So I think I have another analogy, right?
Love it.
I think this is really good. And I think it is about, it's like your body, think of your body as a house, right? Think about that, to have a healthy home, you have to have a good foundation. And when we try to skip steps, this is like, I think sometimes people are always trying to put a roof on a house that has no walls, right? So think about the foundational issues that need to be balanced first. And a lot of this is what, I think the individual can do on their own. How we eat, how we sleep, how we move, making sure that our gut is healthy. And it doesn't mean that, you can't be planning the other things and kind of working on that house as a whole. But I feel like a lot of times we're unwilling to feel uncomfortable. And these symptoms, this uncomfortable state is your body trying to get your attention. So we don't want to dumb it down. We don't want to ignore it. And we want to, and like you said, sometimes, I always look at adaptogens for adrenals. As an adaptogen, they will help no matter what. Is it the best fit for that person at that time? Maybe, maybe not. But I know just bringing something to the table is like, okay, I've got workers here. Maybe that worker isn't quite the one we want working on your foundation. So we'll bring a different one in.
Yep.
But that's the beauty of it. But being patient, working with that foundation, then yes, the walls go up, and then yes, the roof comes on, and then, we're working on everything else, but not letting go of, our symptoms do tell us something. And sometimes when you add something in that your body really wants, it starts to let go of what isn't serving it. And that can feel really uncomfortable. So do not blame the nutrition. Do not blame the herbs for your body letting go of things that did not serve it well anymore. And I think that that's a nice way to think about it. And just like building a house, find the person that's going to be your general contractor, right? Find that healthcare practitioner that is willing to work with you and listen to you and go, okay, well, maybe this didn't work quite right. This is what we're going to do, and this is what we're going to change, which also means that as a healthcare practitioner, we have to listen to the story. We have to understand, what is happening, so we also know how to course correct. I think that, Dave Hogshead, Dr. Dobbins, we've all said, we can't get it wrong. We can only get more right. We can only be more right with that. And I think that as kind of like that takeaway is never losing sight of what we're trying to build, right? Don't lose sight of what we're trying to build, and not try to skip those steps, because when you skip those important steps, you don't have a strong foundation to hold you up.
Yeah. Oh, that's perfect. And just, the overall message, I mean, health takes time, right? This is not something that, just it's a one and done. This is a one pill, one time, one day. This is a journey.
Yes.
So thank you so much, Dr. Annette Schippel, for joining us on the Holistic Matters podcast. It's been a pleasure.
Oh my gosh, me too, Daina. Thank you so much.
Tune in every first and third Thursday for new Holistic Matters episodes, and be sure to like and subscribe to our podcast on your favorite platform. Remember to visit holisticmatters.com for a wide range of holistic health content to keep you up to date on the latest nutrition science and herbal health trends. We hope you enjoyed today's episode, and a special thank you to our sponsor, Standard Process. Thank you for listening. Visit holisticmatters.com for more content. And remember, that's holistic with a W.